Hello, I'm Bruce Murphy, Director of Health for the town of Yarmouth with a coronavirus update. I'd like to tell you right now we're unfortunately still in a red high-risk community for our 5th consecutive week. As you can see from the chart that in the last 14 days there has been 170 positive cases. Within that time the number of tests were 2,551 tests, and our positivity rate has come down, but you can see that we've joined other Cape towns also now up in the high-risk category. I would now like to show you the breakdown of cases that we have in town. Overall, right now you can see that we have 728 positive cases, 100 active cases, and we've had 23 deaths from the beginning of the pandemic. This is a slight increase from our last presentation as we've gone back and looked at death certificates as provided by the town clerk's office. I would now like to show you the graph showing the current active cases since the beginning of the pandemic in March. You can now see the cases that started in March, April, May, then it lowered off during the summer, and then you can see where the second wave started in October, November, where it's really increased almost more than doubled, triple from what we had earlier in the pandemic. This next chart will show the number of cases daily that are reported. You can again see from the beginning of the pandemic the lower number, then even less during the summer when everybody was outside, but then the second wave as it comes in October, November, and December now, you can see where cases have been coming in double digits with a few cases over 20 and even spiking up to the high 20s. I'd now like to break down the number of positive cases throughout the villages. As you can see, they're pretty much community spread throughout the town. You can see West Yarmouth with 292 cases, South Yarmouth 301 cases, Yarmouth Port 135 cases, for a total of 728 overall cases that we've had. I would now like to show you the age breakdown of the positive cases. As you can see, there's been a large increase in the categories, especially between the ages of 20 through 69. So it's not one particular age group that's saying they're getting more cases than the others. You can see it's fairly well spread out between ages 20 to 69. You can also see the increase in the children's ages 0 to 19. The current breakdown of male and females are, males are at 319 and females are at 409 cases from the beginning. I would now like to go over precautions that people can take. It's important that everybody, no matter what age group that you're in, take the important precautions to try to control the spread of the coronavirus. That is by avoiding gatherings, avoiding dinner parties, birthday parties, sleepovers, avoid play dates, avoid carpooling unless family members. If not, mask is required. If you don't feel well or are waiting for test results, stay home, do not go to work or school. We all need to help stop the spread. Remember, mask up, social distance, wash hands frequently. I'd now like to talk to you about the vaccination of the general public and as we go forward. That information is provided to us by the Department of Public Health and the Governor's Office as we go forward. It is currently broken down into 3 phases. As you will see, phase 1 is healthcare workers, hospitals, nursing homes, long-term care facilities, and we're currently working with our first responders. Phase 2, which will follow, which is planned to be in February, no specific date has been set, but it will be rolled out in February, as I mentioned, and that will be informed to us by the Department of Public Health when that date will come out, and that will be over the news media, TV, radio, social media outlets, and it will also be, we'll be doing it on our town website, and will also be included when that phase 2 starts, we'll do a code red call. We'll have another video update explaining that also. But phase 2, the first group in phase 2 is ages 75 and older. Then it goes to people with 2 health conditions. Then it gets down to people that work in restaurants, food industry area, utilities, schools, K through 12, food pantry workers, beverage workers, grocery store workers, utility workers. After that group, within phase 2, it goes down to age 65. Then it goes down to individuals with 1 health condition. After that phase is finished, which is planned to be approximately April, then it will be opened up to the general public. I would now like to tell you about the vaccination sites that will be held across the Cape. We are currently working with the Department of Public Health and the County Health Department on regional sites across the Cape. They will be planned right now as similar to the ongoing testing sites. Those locations will be made available again through mass media, the platforms, through newspapers, radio, and at different towns' websites. We'll also do a code red site when these become available also, but they'll be well publicized. These will be regional ongoing clinics. Hello, I'm here with the Roby Whitehouse Waste Management Superintendent. We're up at the landfill, and thank you for joining today to give the public and the residents an update of what's going on at the landfill since March during the coronavirus pandemic.
Well, Bruce, thank you very much for coming and visiting us. It's always great to have company. I always like to give a tour. I'm always welcome to give tours. Yeah. Our facility has stayed open through the whole pandemic. All the way from the very beginning, our facility's been open 7 days a week. Our top priority is keeping our employees safe so that they can man the facility and keep the facility running for our residents. We did have to shut down our magazine shed because there's only one way in, and it was just too small to continue to keep it sanitized. We also had to set up some stations at our compactors to allow our staff to exit and enter the facility, enter those components so that they could operate them and still give everyone enough physical distance. We've put up some signs at the trash area reminding people to keep a distance and keep their masks on. Most recently, we've added a few new signs on the roadways leading up to the trash cans, as well as out to our compost and to our construction area, reminding people of the necessity to wear masks to keep everyone safe. We also have a recording that you may hear if you come to our facility.
Yes, I did hear that the other day. I'm glad you have that as also a audio reminder that people can hear that.
Yeah, during the holiday season, we did have some holiday music going, and in between the holiday music, we added just a quick little message reminding everyone to wear a mask. Although we are outdoors, we do want to keep everyone safe. And you may see our staff back up if you get too close, because of course we want to make sure that all of our staff stay safe. And reminding each other to keep a distance from each other is all really important, because even though we've been dealing with this since March, sometimes we all forget.
And I know it's been a challenge, because I know you and your staff have been out there reminding people to wear masks, and I know that's challenging, those discussions. And I see that today that we brought a new sign in so we can try to enforce wearing the governor's order of wearing a mask more. And you want to just say where you have the sign located? And
absolutely. Our police department graciously loaned us that sign, and it's at our front entrance. And so when you come into the facility, take a quick look at it. It does remind you as you enter the facility to wear a mask and to keep everybody safe.
Thank you. And what we're trying to do is get that message out into the community to try to change the mindset to make sure you're wearing your mask, you're social distancing, just not here at the landfill, but throughout town, and even back at home, that you're taking precautions. We're a high-risk red community, so the more things that we can do as a precaution, I think helps across the community.
I totally agree. I think that we'd say social distancing. I like to say physical distancing, just because I like to continue to be social with everybody, but I like to do it at a little distance from everybody.
Good. And since
Yeah.
we're right here, you can mention recycle. I mean,
Yes.
you do a lot of recycling up here, and that's so
We do.
important.
We do. As a matter of fact, one of the things that's come up most recently is some frustration about our compactors and the cardboard. We did reduce the opening in our cardboard compactors because we found that there was a lot of contamination from styrofoam. And at our facility, styrofoam's not recyclable. So the opening is small, so that means break down your cardboard before you bring it to the facility so it fits in that slot.
And pizza boxes allowed?
They are allowed as long as you remove that disc that has the grease on it, but absolutely.
Great. Well, that's good news, and I know our community is very forward with recycling. I think that's great. I think that's great what you have up here, and it's a great facility, and I know a lot of people come up here, so we appreciate all the hard work that you do up here.
Well, our team is great, and we're glad that you are here, and we want to make sure that we keep them safe. So tell all of those recycle folks when you see them that you said hello, and give them a thumbs up.
Good. Thank you very much.
Absolutely.
This is great. As we move forward into the new year, we look forward to the vaccination sites, everybody taking precautions, and wearing, everybody needs to wear masks up. Thank you. Thanks for watching. For daily updates on the total number of cases, please visit the town's website. Thank you.